Good morning, good afternoon, everyone, depending on where you are. Like Angelica said, this is the last of a four-part series called our Foundation Series. And we've talked so far about the structure and function of the microbiome and what can go wrong. So our agenda today is pretty simple. It's just to fix the gut. And if you have missed those other presentations, then be sure to log in at microbiomelabs.com under the Education tab. You can find the past recordings, and we will be repeating this again, so you have another opportunity. But we're going to start today with a quick review of a healthy versus a dysbiotic microbiome. A healthy microbiome has low levels of pathogens, a strong mucosal barrier, strong tight junctions, low mucosal inflammation. And this is important because the health of the microbiome impacts our overall health. It produces metabolites and performs functions that benefit us. It contributes to a well-functioning intestinal barrier, supports immune regulation and a healthy inflammatory load, and builds a more resilient environment that is less likely to experience chronic disease. Now, when we talk about the microbiome performing functions and being functional, some of the functions that it's performing are our commensals or our healthy bacteria. They're producing short-chain fatty acids. They're producing vitamins and antioxidants, as well as neurotransmitters, and they help to optimize the gut pH, which we will be spending a lot of time talking about today. On the other hand, a lot of your opportunistic pathogenic microbes are producing functions or byproducts that are a little bit more inflammatory and unhealthy for not only our microbiome, but ourselves as a whole, and those include ammonia, hydrogen sulfide, methane, toxins, and virulence factors like lipopolysaccharide or LPS. Now, there's certain dysbiosis risk factors, and there will be a longer list later in the presentation, but these are things like medications, antibiotics, stress, and poor diet, and they impact the balance of microbes in the gut and lead to dysbiosis. In dysbiosis, we see an abundance of pathogens, a degraded mucosal layer, an inflamed intestinal cells, and an immune response. And this is what we call leaky gut. And because different types of bacteria perform different functions, dysbiosis means that functions being performed in the gut are also altered. And this impacts the gut organ axis. And this is the multi-directional communication system between the gut and extraintestinal organs like the brain and the heart and the skin. But there is hope, and that is exactly what we're here today to discuss. I have 5 steps to help you restore microbiome health and resiliency, and there really should be 6 steps. The first one is foundational, and that's to assess the microbiome. What have those dysbiosis risk factors done to the microbiome? Really, the only way to know is to assess, and here at Microbiome Labs, we like to use our functional microbiome analysis, BiomeFx, to do that. And then we're going to talk about diet. What is the best diet for a healthy microbiome? Digestion, how to remove dysbiosis risk factors, support commensals, and reduce inflammation and rebuild those barriers. So first up is diet. How does the diet impact the microbiome, and what is the best diet for the microbiome? So this is your cheat sheet for a microbiome-friendly diet, and it starts with diversity. Diversity in the diet means diversity in the microbiome, since different bacteria feed off of different foods, especially fibers. So if you want to have a lot of different species, which is what we typically see in a healthy microbiome, lots of species that gives us a more resilient environment, then you need to eat a variety of foods. Also, organic antibiotic-free sources to avoid elimination of beneficial bacteria. Those antibiotics in the food will kill off your beneficial bacteria. We want it to be high in functional fibers, polyphenols, and antioxidants. And when we talk about feeding those healthy commensal bacteria, this is what you want to focus on. This is their preferred fuel. And when they consume these foods, they will give us healthy byproducts as a result. Some of those functional fibers and polyphenols and antioxidants can be found in fruits and vegetables, legumes, whole grains, nuts and seeds, herbs and spices. We also want a diet that is moderate in protein and fat and low in saturated fat, sugar, and processed foods. Those foods tend to feed our pathogens more than they feed our beneficial bacteria. So you can really start to see how you can help to balance your microbiome just by what you're eating. We also want to limit alcohol intake. Alcohol intake, especially consistently, has been shown to create dysbiosis and increase bacteria like proteobacteria that's more inflammatory, has a lot of lipopolysaccharides. We want to avoid emulsifiers to maintain a healthy mucosal barrier. Things like carrageenan and gargum and polysorbates, those will degrade the mucosal layer. And consider fermented foods like kimchi, yogurt, kefir, and natto. Those introduce lactic acid bacteria to the microbiome that help to optimize the pH and provide us with vitamins and enzymes to help with digestion. And last, raw foods are kind of a fad sometimes. There's great things about raw foods, but if we're at risk for pathogens or we have a patient that is immunocompromised, then we want to avoid raw foods. That will only lead to more dysbiosis and infections. So how do you know how your diet is impacting your microbiome? We like to use BiomeFx, and we can actually see through BiomeFx a lot about diet and how the microbiome is responding. This score is called alpha diversity, and it shows how many species the healthy population has and then how many the patient has. This patient has well above what we would consider for the median of the healthy population. And if I had to guess, I would say that this person has a very diverse diet. So it might be a good challenge for you to count up how many different foods, including herbs and spices, you eat every week, and then challenge yourself to set a goal and increase the number of different kinds of fibers, herbs, and spices that you're eating. So you're feeding more of those beneficial bacteria, increasing the number of species, and building a healthier and more resilient microbiome. The one thing I talk about when I'm doing BiomeFx consults a lot is how healthy is your patient's diet. And that can mean so many different things to different people. And I like to give a reference of the amount of calories we need from protein, carbs, and fats, because a lot of times we see from looking at a BiomeFx that perhaps a patient is eating too much protein or they're not digesting it well. Well, how much is too much protein? So this is just a general guideline set by the Dietary Guidelines for Americans, and it states that most of us need 45 to 65% of our calories from carbs, less than 10% of calories per day from sugar, approximately 28 to 34 grams of fiber per day. That's quite a bit. Only half of Americans get close to reaching that number. 10 to 35% from protein, and that's a very wide range. And what I'd like to point out is there are many different diets out there that can be helpful for different purposes. So this is a very general guideline, but there is room there to kind of play around with those numbers. 20 to 35% from fat and less than 10% of calories per day from saturated fat. And for me, the general rule of thumb that I like to remember is 50, 30, 20. So 50% from carbs, 30% from protein, and 20% from fat. So as we go through here and you learn that having a lot of fat and protein in your diet can really be harmful for the microbiome, and you're wondering how much protein or fat your patient's consuming, and if it's too much, then you can always have them keep a food journal and track their macros, and that will give you an idea. Let's talk about prebiotics, which are the microbiome's favorite food for our healthy commensal. And prebiotics are non-digestible food ingredients that beneficially affect the host by selectively stimulating the growth or activity of one or limited number of bacteria in the colon. They're only prebiotics if they selectively feed the beneficial microbes. So some examples of these are oligosaccharides like human milk oligosaccharides, fructo-oligosaccharides from kiwis and bananas, and galacto-oligosaccharides from dairy, and inulin from foods like oats, garlic, chicory, and leeks, beta-glucans, which we can find in a lot of cereals and mushrooms, arabinoxylans in rice and gargum, pectins from pears, apples, and oranges, and resistant starches from potatoes, plantains, legumes, and oats. And if you want a more extensive list, this is an example of our fiber guide from BiomeFx, and it lists all different categories of fibers and which foods go along with those categories. So I love to give this to patients and have them make sure that they're getting foods from all the categories, because even if they are getting plenty of fiber, it's probably restricted to just a few of the categories. We seem to get in ruts when it comes with food. So venturing out a little bit and trying foods and fibers from different categories can again build their microbiome. This is a summary of studies on 3 to 14-year-old children, and it shows changes in the microbiome with increased fibers, including fructans from fruits and vegetables, almonds, galacto-oligosaccharides from cow's milk, and soluble corn fiber. One thing that I like to point out is that in 3 to 6-year-old children on antibiotics, they studied the antibiotic use along with fructans, so inulin type fructans. And they were given 6 grams per day of these inulin type fructans along with the antibiotics. And there was actually a stabilization of bifidobacterium during antibiotic treatment. So bifidobacterium is very important for its anti-inflammatory properties, short chain fatty acid production, but it's pretty sensitive to antibiotics. When we think about bifidobacteria, we think of it as being some of the first bacteria, healthy bacteria in a young child's gut. And we know that it's in probiotics. So it's very beneficial for us. But as soon as we start taking antibiotics, it kind of wipes it out. So this is pretty significant that when you take these fructans along with the antibiotics, that we saw a stabilization of the bifidobacteria. It protected them. We didn't wipe out as many of the bifidobacteria from those antibiotics. And this is really important because this is during the critical development window of the immune system. At 3 years old, that's when the microbiome is helping to teach the immune system how to react properly for the rest of a person's life. So it's really important that we're able to maintain this bifidobacteria and support the immune response during that time. Now we're going to touch on polyphenols. These are compounds in plants like fruits, vegetables, cereals, tea, coffee, and wine. They are anti-inflammatory, antioxidant, neuroprotective. However, when we eat them, 5 to 10% is absorbed in the small intestine. The rest goes to the large intestine. So mostly there, it's degraded by the microbes, and the microbes use it to create healthy byproducts. It does act as a prebiotic and an antimicrobial. And because it does that, it helps to support the commensals while depressing the pathogens. So it's a prebiotic for those beneficial bacteria like Akkermansia, but it's antimicrobial to some more of your pathogens like Clostridia and Salmonella and Staphylococcus aureus. Berberine is a powerful polyphenol that has gained a lot of attention lately for its ability to act as both a prebiotic and an antimicrobial. And I want to touch on this review article. This is a very lengthy article that if you're interested in, I encourage you to pull it up and dive into it a little bit deeper. And I'm going to touch on what it found as far as what is the best diet for the microbiome. So is plant protein better or animal protein? Well, plant protein wins out. When the diet was higher in plant protein than animal protein, we saw an increase in those beneficial bifidobacteria and lactobacillus. And as a result, we had increased short chain fatty acid, improved gut barrier, and Tregs. And at the same time, we saw a decrease in some of the more inflammatory bacteria like perfinogens, and as a result, decreased inflammation. With animal protein, diets that were higher in animal protein, we saw the opposite. We saw elevated pathogens like allostipes and Bilophila wadsworthia, which resulted in increased TMAO, which is a predictor of heart disease and stroke, increased cardiovascular disease and IBD. And at the same time, we saw less of the beneficial bifidobacterium and decreased short chain fatty acid production. And as far as fat, unsaturated fat versus saturated fat. With a high unsaturated fat diet, foods that were higher in, from olive oil and avocados and almonds and sesame seeds, we saw increased lactic acid bacteria, Akkermansia, bifidobacteria. However, with a diet that was higher in saturated fat and include more foods like coconut and palm oils, we had increased Bacteroides, Bilophila, and Faeculobacterium prausnitzii, which tends to be a little bit more commensal, but overall, we saw with the higher saturated fat diet, there were elevated bacteria that were more inflammatory. And when we compare the Western diet to the Mediterranean diet, the Western diet showed decrease in total diversity, decrease in your beneficial bifidobacteria and lactobacilli, and increase in Bacteroides, which sometimes can be a little bit more inflammatory. And the Mediterranean diet, on the other hand, we saw increased total diversity, bifidobacteria, lactobacillus, roseburia. So a lot of commensals and anti-inflammatory bacteria were elevated on the Mediterranean diet. Now, one of the roles of the gut microbiome is the development and efficacy of the immune system. So this slide demonstrates the effects of dietary components on the immune system, starting with prebiotics. Prebiotics, we see increased anti-inflammatory short-chain fatty acids and interleukin-10, while decreasing inflammatory bacterial toxins like LPS and inflammatory cytokines like interleukin-6. Polyphenols also increased anti-inflammatory short-chain fatty acids while decreasing CRP and increasing IgA. Unsaturated fats decreased inflammatory LPS, while saturated fats did the opposite. And animal protein increased short-chain fatty acids, while we see pea protein increase short-chain fatty acids. Now, this slide shows metabolic markers, and it might not be surprising to you that when you think about prebiotics, which a lot of times are fibers, they decrease total and LDL cholesterol, triglycerides, and improve insulin sensitivity. We all know that fibers will do that, but the probiotics were also shown to decrease total cholesterol, LDL cholesterol, triglycerides, while improving HDL cholesterol and insulin sensitivity levels. So this is actually the bacteria in your gut who are improving these metabolic markers. We don't know all the mechanisms by which they do this yet, but they may do this in part by reducing fatty acid synthesis in the liver. And our step number 2 is digestion. When you think about repopulating the gut, you may think about the seed and feed method. So seed with probiotics, feed with prebiotics. However, we often see that this isn't enough, and there's what I call the missing piece to the puzzle. And you can really throw as many pro and prebiotics into the gut as you want, but if that environment isn't conducive for them to work, they're not going to do any good. So today we're going to talk about that missing piece, and it's the environment. And the environment is largely produced by the pH, and pH is altered by the digestion. So we're going to talk about digestion and how that alters pH to set up the correct environment for your pro and prebiotics to work. We're going to start with reviewing the pH of the gastrointestinal tract. And this is really important because bacteria live in different pHs. So different bacteria prefer different pHs. And as I just mentioned, digestion has a lot to do with the pH of the GI tract. So in the oral cavity, the pH is maintained near neutrality at about 6.7 to 7.3, which is very close to the pH of the rectum. And this is really important, as we're going to see, because if oral pathogens can make it through the digestive system alive, they can colonize the gut microbiome in the colon and increase the risk of inflammatory conditions like IBD and colorectal cancer. So the stomach is quite acidic at 1.0 to 2.0 due to hydrochloric acid, which is important for digesting food and eliminating pathogens. The duodenum is slightly more alkaline than the stomach at 6.1 as the pancreas secretes bicarbonate into the small intestine to neutralize the HCl, and the jejunum is about 7.1 and the distal small intestine 7.5, so it's a little higher in alkalinity. And then we start producing short chain fatty acids in the colon, and these are acids, so they will decrease the pH. And we've got 6.0 here. And then finally in the rectum, 6.7 to 7.0, which is again very similar to the oral cavity. Now we're going to look over here And as the pH in the mouth and rectum are very similar, so is the bacterial count. In the oral cavity, it's 10 to the 11, colon 10 to 12, so very similar. In between the oral cavity and the colon, the bacterial count increases from top to bottom, with the least amount of bacteria in the stomach, where it's the most acidic, and the most in the large intestine, where the pH is close to neutral, but a little bit more on the acidic side. This weekly acidic pH in the colon is really important for helping to maintain eubiosis, or that microbial balance. It inhibits pathogens like C. diff and promotes the growth of commensals. It's important for absorption of vitamins, electrolytes, and iron. It activates digestive enzymes, and it promotes the fermentation of microbes and promotes the elimination of toxic substances. Sorry, my computer is timing out on me. See if, there we go. Okay, a little bit more microbiology for you. We're going to talk about neutrophils, acidophiles, and alkalophiles, so where specific bacteria like to live as far as pH. Bacteria can be categorized by the pH at which they grow the best at. Most bacteria are considered neutrophiles. They grow best at a pH within 1 or 2 pH units of a neutral pH of 7. The optimal pH of Akkermansia is 6.5. E. coli is 4.5 to 9, which is a very broad range. And I'm going to talk on the next slide about why E. coli has such a broad range with which it can grow in. And Bacillus subtilis at 8. And then we've got acidophiles, which grow optimally at a pH less than 5. They like a really acidic environment. Actinobacteria, which is the phylum that Bifidobacterium lives in. So this is that good Bifidobacteria, is actually an acidophile. This is also the preferred pH for butyrate production. And Lactobacillus is another acidophile. It prefers a pH of 4.5 to 6.5, while alkalophiles prefer a more alkaline pH of around 8 to 11. And an example of this is the pathogen Pseudomonas. So in general, a lot of your commensals like it to be a little bit more acidic, and your pathogens like it to be a little bit more alkaline. And if we know that, and we are looking at a test like BiomeFx, and we're seeing who is growing there, then we can kind of guess what the pH of the environment is. And then we can talk about what is causing those pH shifts and how to optimize it. Okay, so the conditions faced by these microbes fluctuate very rapidly, and they have adaptive mechanisms to protect them. So E. coli, for example, must be able to survive exposure to the acidic pH of the stomach in order to colonize the intestinal tract, and they must be able to adapt to a sudden and temporary drop in pH. So one strategy they use is a global stress response known as the acid shock response, which results in acid tolerance and involves the inductions, turning on of certain genes, and the repression of others to essentially reprogram the cell. And as a result, molecules called chaperones are expressed. These function to help fold or refold unfolded proteins and allows neutrophils to survive exposure to an acidic pH. Another example are bacillus spores. We're very familiar with these. These are the spores that are in megaspore, HU58, Restore Flora, Serene Skin, for example. And they survive acidic conditions by retreating into their dormant endospore. And then when the environment is more conducive for them, they can open back up. And another example is H. pylori. H. pylori is actually a neutrophil, or neutrophile. It likes a more neutral environment, but it colonizes the stomach. It does this by creating a microenvironment in which the pH is nearly neutral by producing large amounts of the enzyme urease, which breaks down urea to ammonia and carbon dioxide. And the ammonia raises the pH, makes it a little bit more alkaline, and the H. pylori can thrive there. So this is a bidirectional shift in pH. First, we have the microbes shifting the pH. They do this by the metabolites they produce. They can produce short-chain fatty acids to make it more acidic, or ammonia to make it more alkaline. And on the other hand, The pH in the microbiome will shift which microbes can thrive there. My computer is timing out. There we go. Okay. Uh-oh. So we're going to talk about diet and pH shifts. Diet will shift the pH in the microbiome. And one of the ways that it does this is that when we feed the microbiome fibers, it will lower the pH. When we feed it protein, it will include or induce a higher pH in general because, again, of the metabolites that it's producing. So proteolytic fermentation, which happens after we eat protein, can also result in short chain fatty acid production. So there is one caveat there. So if we have a high protein, high carb diet, we're going to have a more acidic environment. If we have a high protein diet, but it is low in carbs, it's going to be more alkaline. And in research, we see that this decreases Roseburia and Eubacterium rectale, which are commensals. It also lowers actinobacteria. Digestion can also shift the pH. We mostly want digestion to happen in the upper digestive system, including the small intestine. But if we have a deficiency in any of the processes of digestion, then we're not breaking down and absorbing these foods like we should before they get to the colon, and they will arrive in the colon instead of being digested, and it's like a buffet there for the bacteria. And this will shift the pH due to over fermentation of your proteins or your fibers. Transit time is another part of digestion that can impact the pH. We're talking about how fast things move through the GI tract. Constipation and diarrhea will shift the pH of the microbiome, so keep that in mind. And this will, in turn, shift the composition, who is in the microbiome. So it depends on substrate availability in the colon. And if you're mostly using saccharolytic to proteolytic fermentation, if you have long gut transit time, that's constipation. It has been associated with a higher fecal pH and shift in microbial metabolism from saccharolysis towards proteolysis. So after everything's sitting there for a while, we've eaten up, fermented all the carbs, then we're going to turn our attention to the protein that's available. We're going to ferment protein, and that's going to induce and more alkaline environment. So constipation will result in an alkaline environment. And then your metabolites like short chain fatty acids, secondary bile acids, tyramine, histamine, these things produced by the microbiome can stimulate gut motility and affect transit time. So in turn, the microbes produce these metabolites that can induce constipation or diarrhea, or at least alter transit time. So in general, saccharolytic fermentation, which is what happens when we ferment carbs, fibers, will result in a more acidic environment because we have more lactate and short chain fatty acids. Whereas proteolytic fermentation, when we ferment protein or the bacteria are fermenting the protein, that is going to result in a more alkaline environment because we're producing more ammonia. There is such a thing as acidic stool. It happens a lot when we have quick transit time or diarrhea. And some of the things that can lead to an acidic stool include infection of acid producing bacteria like E. coli, lactose intolerance, bile acid malabsorption, and malabsorption of carbohydrates and short chain fatty acids, I have that on there twice, I just noticed. And so a high-fat diet and bile acids are not properly absorbed. We have overproduction of bile acids by the liver, IBD, celiac disease, SIBO, and pancreatitis can all lead to bile acid malabsorption as well. So if you're looking on a BiomeFx test and you're noticing a lot of acidophils, so a lot of bacteria that like more of an acidic environment, then you can look through this list and start to figure out why the environment may be too acidic to have good, healthy eubiosis in the microbiome, and it's preventing some of those other beneficial bacteria from growing. Pharmaceuticals can also alter the pH shift. mostly pharmaceuticals that are metabolized in the large intestine. And three of the main ones are laxatives, antidiarrheals, and antibiotics. Laxatives will increase the acidity because we're speeding things up, whereas your antidiarrheals are going to increase alkalinity because we're slowing things down. And then your antibiotics kill your short chain fatty acid producing bacteria like bifidobacteria, and this is going to increase alkalinity. There's also a carbose anti-diabetic drug that's been reported to increase total short chain fatty acids, so it can lead to increased acidity in the microbiome. And glyphosate. In the diet section, I recommended an organic diet for a healthy microbiome, and this study is one reason why. We did a study with glyphosate, and a healthy toddler was chosen as the donor. We exposed their feces sample to 100 milligrams per liter of glyphosate or Roundup over a 3-week period, and then followed it up with co-treatment of Megaspore Biotic. And what we saw is that the glyphosate resulted in acidification of the gut microbial ecosystem. It increased the production of acetate and lactate and decreased lactate consuming species. And this favored the growth of bacteria that can tolerate a lower pH, like actinobacteria and lactobacillus, which might not seem like a bad thing. However, it inhibited some of those bacteria that can't live in that very acidic environment and created some dysbiosis. So it suppressed Bacteroides, which produces GABA and propionate. So we saw less Bacteroides, and as a result, less propionate and GABA production. It also reduced alpha diversity, so those total number of species, and Megaspore recovered propionate and alpha diversity. I'm going to show you an example of what this might look like on a BiomeFx test. So this is an example of too alkaline. Maybe the environment has too much ammonia. It's a little bit too alkaline for some of those healthy commensals to thrive. And we see it here with low actinobacteria. Remember, actinobacteria is where bifidobacteria is. It likes a really acidic environment, and here we hardly have any, so that's a clue that it may be a little bit too alkaline. And then we've got our methane producers. Methane slows transit time, it creates constipation. That is going to result in a more alkaline environment. So we've got methane production, as well as eukaryote, which are archaea that produce methane. And then we have another methane producer family down here. I'm going to see if I can say this correctly. Methanomycelicoccaiceae. There we go. We also have high propionate. So propionate producers don't grow well in an acidic environment. And we have high propionate production here, so we may be tipped into an environment that's a little bit too alkaline. We've also got low acetate and lactate, which tend to create a more acidic environment. So taking all these clues into consideration, we don't test pH outright, but we can see kind of what is happening with the pH in the environment based on who's able to live there. So what do we do about it? Well, first of all, let's talk about why is the environment here not acidic enough? It could be several different reasons. Maybe we have a diet that's high in protein and low in carbs, poor digestion of protein, slow transit time or constipation, low short chain fatty acid production, or dysbiosis with a lot of methane producers. So then some recommendations might be to decrease protein and increase carbs or fibers in the diet, to offer digestive support, maybe bitters, enzymes, our MegaGuard, address methane producers and alter the diet a little bit. In general, when we see a lot of methane producers, then we do recommend more of a plant-based than animal-based diet. We know that Megaspore and MegaPre increase short-chain fatty acid production, which can create a little bit more of an acidic environment. And then you might do lactobacillus supplements and fermented foods to also help to increase lactate production. And that was step 2. Step 3 is remove additional dysbiosis risk factors. And here is your more extensive list of some of those factors that can create an environment in which your commensals just can't thrive, or maybe even kill some of them off. And it includes prescription medications like antibiotics and PPIs, even sometimes natural antimicrobials, pesticides, pathogenic infections, excessive alcohol intake, smoking, stress, lack of sleep, intense exercise or lack of exercise. We need to make sure we're getting the right amount of exercise, lack of diversity in the diet, the standard American diet that's high in saturated fat and sugar, heavy metal exposure from food and water, suboptimal digestive processes, and oral dysbiosis. And we've talked about a lot of these already, especially diet and digestion. So I'm going to focus on 2 that we talk a lot about when we're doing BiomeFx test, and those are oral dysbiosis and stress. But first up, how do you know if you have dysbiosis in the gut? And this is another example from BiomeFx. This is that alpha diversity graph that I showed at the beginning. And we see that this patient, the other patient, their line was higher than the box, but this one's a lot lower. So this means they have less diversity, less species in the gut. So they've probably got some dysbiosis. We've also got a low beta diversity. Beta diversity looks at who is in the gut and how similar are they to the healthy person. This may not always mean that the bacteria that are there causing the score to go down are pathogenic. Sometimes it could just mean they have a very unique microbiome, but most of the time it means that we have some dysbiosis. Then we see a lot of pathogens here, and their numbers in red, which means that they're elevated. And these are dysbiosis ratios, which are a very good clue that there's dysbiosis if your dysbiosis ratios are elevated or decreased. But here we have elevated proteobacteria in the blue. It should be about 1.5, and we've got about 3.8. Proteobacteria has LPS, which is very toxic and inflammatory and leads to leaky gut. So that's a good sign that we've got some dysbiosis and intestinal barrier permeability. So oral dysbiosis. There is a bidirectional relationship between oral and GI dysbiosis seen in periodontitis and IBD, meaning that not only does periodontal disease increase the risk of IBD, but IBD increases the risk of periodontal disease. Oral pathogens are transmitted to the gut via the GI tract, mostly when we swallow them. And the stomach acid and bile make up this chemical barrier that should prevent oral microbes from spreading to the gut. But when this barrier is broken, they colonize and reshape the intestinal microbiome. And oral pathogens are very inflammatory. So when they do reach the gut and they colonize there, they can play a role in IBD and even increase the risk of colon cancer by 6 times. So gut dysbiosis triggers an intestinal immune response. When we think about how these microbes are getting from the oral cavity to the gut, it's pretty self-explanatory. We're swallowing them, and there's some reason that those chemical barriers, mostly stomach acid, are not killing them off. It's very common for our patients not to have enough stomach acid. PPI use is very common. So it's very easy for them to make it through the stomach alive and get to the colon and colonize. But how are the bacteria in the colon, and how's the microbiome actually impacting the mouth and periodontal disease? Because this is a bidirectional process. So gut dysbiosis does trigger an intestinal immune response, which will manifest as intestinal and systemic inflammation. So you've got inflammation in the gut, and because of that bidirectional communication system with other organs, we now have inflammation and circulation, which is going to make its way up to the oral cavity and induce inflammation there and aggravate periodontal disease even more. Now, again, the oral pH is very similar to the pH in the colon, and bacteria can thrive there. So while we aren't necessarily testing specific oral microbes on BiomeFx, we can get clues that there are some oral pathogens that are making it their way through that chemical barrier and ending up in the colon. And this is what we might see on BiomeFx: Porphyromonas gingivalis, Fusobacteria nucleatum. So we see that in BiomeFx in the phylum section as Fusobacteria. Prevotella, Klebsiella, which we will see as Klebsiella pneumonia on the pathogen section, and Campylobacter species, which will show up in the pathogen section as well. So this is your cheat sheet if you are running BiomeFx test and want to know what we are seeing on BiomeFx that could mean that chemical barrier has been broken, or there has been some past oral or current oral infections. There's a few others too: Synergist disease, Candidiasis sacrobacteria. Those are phyla that also have species that can be from oral dysbiosis. So we all know that stress can impact the microbiome, and a lot of times we do see that on that alpha diversity score that we've been talking about, sometimes it'll be low just from stress. But how exactly does stress impact the microbiome? One way is that stress alters eating behaviors, which directly impacts the microbiome. I always like to ask how many of you prefer to eat Brussels sprouts and broccoli and asparagus when you're sick. Most of us don't, but as I ask this question, I'm finding that there's a few weirdos out there, no offense, who really do like to eat these things when we're sick. But most of the time, those are not what we go for when we're sick. Most of the time, when we're not feeling well or when we're stressed, we're reaching for more of the standard American diet. We're reaching for more high fat, salty, sugary foods. So that's one way that stress is impacting the microbiome, by changing our eating behaviors. Now, stress hormones, inflammation, and alterations due to stress reshape the microbiome, creating dysbiosis and intestinal barrier permeability. And the heightened inflammation that accompanies stress and depression triggers blooms of pathogenic bacteria that then will encourage dysbiosis and leaky gut. And I always find this really fascinating, but some bacteria can encourage dysregulated eating. So they kind of hijack our food preferences and they make us crave unhealthy foods to feed them. Cortisol directly impacts gut function. We do have cortisol receptors in the gut, and cortisol is released from the adrenal cortex and reaches the gut through circulation. And that it impacts microbiota by altering gut transit time, intestinal permeability, and nutrient availability. Our fourth step, supporting commensals, and this is where the paradigm shift of microbiome labs come in. A lot of times when we think about helping to rebalance the microbiome or supporting the microbiome, we've been taught to look for which bacteria in the microbiome we need to eliminate. But it's just as important to work on supporting the commensals, because they're actually our soldiers in the microbiome. We can't micromanage the microbiome because we have yet to discover everything that's happening in there. However, we can send our soldiers in, our healthy commensals, and they can go to work for us, balancing the microbiome, helping to decrease the number of pathogens, and making sure that we're producing enough vitamins and all these beneficial microbes. So I can't stress enough that at the same time you're thinking about who is in the microbiome that we need to eliminate, it's more important to think about who is in the microbiome that we need to rebuild. If you just eliminate, then those pathogens are just going to keep coming back because we don't have any soldiers in there to fight them off. So we've got to build up our soldiers and our healthy commensals. And when we think about rebuilding the ecosystem, we need to make sure that we are creating a comfortable home, a comfortable environment with the optimal pH, few competitors, and eliminate dysbiosis risk factors. Think of the microbiome as their home and creating a space that is as comfortable as possible for them and nourishing for them too. They're your guests, so you want to take care of them. You want to feed them well, and we can use supplements to give them a little boost and rebuild their numbers. If you're wanting to supplement to rebuild commensals, you're going to want to know the difference between probiotics and postbiotics. So probiotics are live microorganisms that, when administered in adequate amounts, confer a health benefit to the host. While postbiotics, which are also known as paraprobiotics, ghost biotics, heat inactivated probiotics, these are inanimate or dead microorganisms and their components that do confer a health benefit. Postbiotics are friendly, like friendly but dead. I messed that up. Friendly but dead, like Casper. So you can think of your postbiotics like Casper. So you're going to want to use probiotics that have been proven to colonize and boost numbers of commensals in the gut, exclude pathogens, and glean their health benefits, like Megaspore. We know that Megaspore will colonize the gut for 21 to 28 days. And then supplement with postbiotics for their specific research benefits, but know that they're not going to colonize. There are still benefits to postbiotics, but if you're wanting to rebuild the numbers in your gut, that's not the purpose for them. An example of that is our Palogard, which is a rooterized strain. It's a ghost biotic. We know that it's dead when it goes in, but its function dead is to bind to H. pylori, and it does that very well, even though it's dead. Now, once this eubiosis is reached, your probiotics may not be, your postbiotics may not be needed, as the microbiome should be able to function and produce on its own. However, I do think it's always a good idea to do a maintenance program because we're continually exposed to those dysbiosis risk factors. So we need to continually work on supporting those numbers. And our last step is to reduce inflammation and rebuild barriers. So your patients have been exposed to dysbiosis risk factors. It's changing who's in the gut, but it's also leading to intestinal barrier dysfunction or leaky gut. And now we need to go in and do a little bit more healing. So first, we're going to talk about reducing inflammation in the gut. And we can really make a lot of progress with reducing inflammation in the gut just by those things we've already talked about: diet, digestion, removing dysbiosis risk factors, and supporting commensals. For additional support, you may want to add immunoglobulins. These are antibodies that bind to antigens, including pathogens and lipopolysaccharide. Bioflavonoids and polyphenols. We find these in things like megamucosa, as well as turmeric, which has had, or curcumin, a lot of research around IBD. These can be very anti-inflammatory and serve as antioxidants. Oligosaccharides and other fibers that increase short-chain fatty acid production. Now, short-chain fatty acid regulates several leukocyte functions, including production of anti-inflammatory cytokines like TNF-alpha and interleukin 6 and 10. PRMs from fish oil will increase SPMs. They resolve acute inflammation in the intestinal barrier. That's what their job is. And vitamin D also limits inflammatory pathogens and promotes immune tolerance. Now we've reduced inflammation and we want to rebuild barriers. Again, we can do a lot with what we already talked about: diet, digestion, removing dysbiosis risk factors, supporting the commensals, and reducing inflammation. That's going to allow those barriers to be rebuilt. If you want additional support, then you may consider specific amino acids. These are also found in our megamucosa. Fish oil supports goblet cell abundance and tissue integrity. So we're actually helping to support the rebuilding of the mucosal and intestinal barriers with fish oil. Oligosaccharides and other fibers that increase short-chain fatty acid production. One of the functions of short-chain fatty acids is to facilitate tight junction assembly and heal the gut. vitamin D to strengthen tight junctions and improve mucosal repair. And you might consider glutamine. We don't use it a lot. I try to be very cautious with it, especially if you're running BiomeFx and you're seeing that you have high ammonia producers. Glutamine will result in elevated ammonia, and it can be neuroexcitatory for some people. Some people just don't tolerate it very well. Special considerations. Now, our IgG and our megamucosa do have beef in them, beef immunoglobulins. So if you have patients that have a beef allergy, alpha-gal, or vegetarian or vegan, then you can still do a lot through diet, digestion, removing dysbiosis risk factors, and supporting commensals. So all those things we already talked about, it's going to go a long ways, even if you can't do IgG and megamucosa. And for supplements, you may want to try Megaspore, which is going to competitively exclude some of those inflammatory pathogens. And once this happens, it allows the body to heal itself. Megamarine reduces inflammation, supports goblet cell abundance and tissue integrity. So we're rebuilding that mucosal layer. Mega Pre increases short chain fatty acid production, it reduces inflammation and facilitates tight junction assembly. And vitamin D limits inflammatory pathogens and promotes immune tolerance, strengthens tight junctions, and improves the mucosal repair. So don't worry if you can't do IgG and megamucosa. Mega IgG is one of my favorite things to use, but in some patients, it's just not possible. We can still heal the gut and make a lot of progress by using some of these protocols. And that is it. I've got a few reference slides for you and a little commercial break here before we get to questions. Our next foundation webinar is the deep dive webinar on BiomeFx. We also are doing a 4-part series on BiomeFx, and we are about to start over on presentation 1. So if you haven't caught the first of that series, then it's coming up May 22nd, Becoming a Microbiome Expert with Kara Seidman. And we also have the mini keynotes, Gut GLP-1 Connection on June 5th. We have 2 presenters from 4 to 6 p.m. Central Standard Time on June the 5th, talking about GLP-1. Okay. And y'all can scan if you want. I think the link has been dropped in the chat box, but you can scan there too to sign up. And we'll see what kind of questions you got. This is a great question. Is it true we should rotate probiotics every few months to avoid monoculture? And the way that it works, I would say not necessarily. It depends on which probiotics you're using. The way it works with Megaspore is there are 5 bacillus strains in Megaspore, but research shows that those 5 bacillus strains are working in the environment to create an optimum environment for other beneficial bacteria to thrive. And as a result of using Megaspore, especially along with Mega Pre, we see a rise in other beneficial bacteria like Akkermansia and bifidobacteria, Prosnutzi, lactobacillus. So even though you're getting those 5 bacillus strains from the bottle, you're actually having the foundation and regrowth of those other beneficial species. So you don't need to go back in with bifidobacteria or Akkermansia. If the environment is conducive for it, those bacillus strains will help them to grow back. Now, a lot of times what happens if you notice you are giving a specific probiotic and maybe it's helping and the patient stops, or you reach a point where it's not helping anymore, it is because it is arriving there dead as a ghost biotic, and it's serving some purpose and it's helping while it's there, but it's not colonizing. What pH do methane, not bacteria, they're archaea mostly that produce methane, but where do they thrive? They like more of an alkaline environment. They produce ammonia. They don't produce ammonia, but they create more of an alkaline environment. So most of the time we see methane producers with constipation and the environment's a little bit more alkaline. So if you do notice that you have intestinal methane overgrowth or an overproduction of methane, then going in and helping to acidify the environment may help grow those commensals that can compete with them. So then using something like your lactobacillus probiotics or omega pre to increase short chain fatty acids can help to acidify the environment a little bit more. So, looking at the pH of the intestinal tract, I would assume alkaline water is messing up GI tracts. I've had this conversation a few times with providers, and it's possible, but it may not exactly end up in the GI tract that way because of all the chemical shifts that happen from when we swallow something to when it ends up in the colon. Um, like I said, it might, but it might not. It's just going to depend. Okay. I think that's it for now.